and now I would like to ask Professor Grzegorz Bilo from Italy to present us the topic of environmental determinants of circadian blood pressure variability. Grzegorz, the floor is yours.
Thank you. So first of all, a big thank you to Marek Reiser and my friends from Krakow for inviting me again this year, and it's always a pleasure to come back. I was asked to talk about the circadian blood pressure variability, and we had, in a way, an introduction about what might be relevant in the circadian rhythm of from different standpoints, and this includes also blood pressure in its variations. This is my disclosure. What I will focus on is what is the most studied aspect of circadian blood pressure variability. I will not be talking about morning blood pressure surge, which is another circadian element of what we see in 24-hour blood pressure recording, but I will mainly focus on the, I will not be using the pointer. I will mainly focus on the day-night blood pressure change, which is very well known for many years, and it's also defined as nocturnal blood pressure dipping. As you know, physiologically, blood pressure decreases during the night by at least 10%, and this is defined as a condition of dipping. When it is less than 10%, we are talking about non-dipping, and if we have the opposite pattern, meaning that blood pressure increases actually during the night, we can talk about rising blood pressure, the riser pattern, and we may also talk about the extreme dipper when this dip is particularly pronounced, more than 20%. And these patterns are known to have prognostic relevance in hypertensive patients, mostly in hypertensive patients, not so much in normotensive, with non-dipping and especially rising pattern being associated with worse outcomes. Obviously, this is a pattern which depends on two elements: daytime blood pressure and nighttime blood pressure. So, which is the more important driving factor of the two. Obviously, we are looking at the difference, so both matter, but at least from a prognostic perspective, the nighttime blood pressure appears to be the more important element, and there are several studies showing that when you adjust daytime for nighttime, nighttime might be the more important element, and so most focus in the study of these patterns is on the nighttime blood pressure. And I will cite you our recent position paper of the other working group in whose works I take part, which is the working group of the ESH on blood pressure monitoring at cardiovascular variability, which published this position paper this year on nocturnal blood pressure. And as you may see, environmental factors are actually mentioned as one of the elements that might have an impact on nocturnal blood pressure and consequently on day-night changes. But, if you look inside the paper, there is, again, not that much attention to the environmental factors, and I've prepared this graph for another meeting, and when I looked at it again, I realized that actually I did not consider any environmental element here. I thought about where they could fit in, and probably they might fit in as either an additional factor or something which affects sleep quality, sleep structure, and there is another aspect which is hypoxia. I will be coming back to it. So, which environmental factors could be relevant in this context? I will focus on four of those, which are seasonal changes, and as I will be talking about seasonal changes in blood pressure. So I will just limit myself to the circadian blood pressure changes. I hope not to overlap too much. Noise, pollution, and altitude. So first, seasonal variation. This is a meta-analysis done by Tassos Kolias from Athens, and as I said, I will not be dwelling too much into the fact that we know that overall blood pressure decreases during summer, but when you when you take the data from studies which use 24-hour blood pressure monitoring and you split them in day and night, you will find that what actually changes is a daytime blood pressure. Nighttime blood pressure stays more or less the same, even slightly increases. So if you take these two elements together, there is no surprise that, as found in this Japanese study, when you look at the winter and summer months, you will see that during the summer there is less dipping, and there is a shift from dipper to non-dipper categories among the patients who did this, who participated in this large study. What could be the sources of these seasonal variations in 24-hour blood pressure profile? In part, they are the same causes which lead to changes in blood pressure during different seasons. First of all, obviously, there is the effect of climate or weather, including foremostly the outdoor and the indoor air temperature. And here, probably, what counts is the difference between outdoor and indoor. So it is logical that in summer you will have higher outdoor temperature, but indoor temperature might stay more or less the same, which would be consistent with these patterns that we observe. Daylight exposure, we just heard about the importance of daylight exposure. It may count as well, but also other factors such as outdoor-indoor air pollution, behavioral confounders. We know that people change diet between seasons, they change their physical activity, they go on holiday, so are less stressed. So all this might play a role, as well as sleep quality and treatment modifications. Just give you a couple of examples. This is one of the studies run by Pietro Modesti from Florence, in which we also took part. Again, this compares what I have already shown, that in summer, which are the dark circles, there is a tendency for daytime blood pressure to decrease, while the nighttime blood pressure overall stayed more or less the same. But when you split the population and looked specifically at the elderly, you found that there might be even an increase in nocturnal blood pressure during the summer, but this was mainly restricted to treated hypertensive. So and the explanation might be that the doctors, in Italy at least, tend to reduce blood pressure, antihypertensive treatment, especially in the elderly, to prevent hypotension in the warm season. And if you do this, you risk that your nocturnal blood pressure will go up. So that's the interaction, let's say, between temperature and treatment, which could be relevant in this context. And again, from Pietro Modesti, there were this additional data looking more specifically, trying to discern which blood pressure is affected by which factor, and they came up with this conclusion that when you look at daytime blood pressure, what counts more is the outdoor temperature. This was actually temperature measured in the vicinity of the patient, of the participant, but regarding the nighttime blood pressure, the daylight exposure, so the duration of the night darkness, would be the more important factor. What about air pollution? So there are some data on this, not that many, and I think probably the most important study comes from Michel Bournier group. So it's a quite complex slide, and Michel could explain it much better than I. But basically, the message of this slide is that when you adjust for most conventional factors, including age, sex, and so on, plus also the factors characterizing the renal function and sodium balance, you see that people who are during the days which were characterized by increased air pollution, this was done in Lausanne, there was reduced systolic blood pressure dipping, And this effect was seen with a lag, so with time delay between 0 and 2 days, so it was quite immediate, and then with time it tended to decrease. So this is an evidence that air pollution can have quite direct and quite immediate effect regarding the day-night blood pressure changes. And this was, as you can see on the left side of the slide, this was mainly driven by nighttime blood pressures, not by daytime blood pressure, which is not on this slide. So we said that one of the intermediate mechanisms could be the sleep quality. When we are too hot during the night, we don't sleep well. When we have noise, we don't sleep well. When we have other factors, our sleep quality might be involved. We don't, as far as I know, we don't have any direct evidence showing the involvement of sleep quality in these changes. But when we look at studies addressing the relationship between sleep quality and dipping, as expected, we find that both subjective, but there are also studies on objective sleep quality, is actually related with dipping, meaning that when the sleep quality is worse, to put it briefly, you are dipping less. So this might be involved, although we don't have direct data. What about the noise? The noise logically would seem something that could interfere with sleep, so lead to decreased dipping. Actually, the data are not so consistent in this regard. We have data from the study done in Krakow with airport noise, which, as far as I remember, were negative from the dipping standpoint. The only study I found that when they found some relationship was the Hyena study, but they only found it with road traffic noise and only for diastolic dipping. So this is, I would say, not convincing evidence. The last part is something we have been working on, and it is a hypoxia at high altitude. This is an example of blood pressure monitoring done on the left at sea level, on the right at high altitude. This is Capanna Regina Margherita. You can see that the blood pressure profile changes, so this was a preliminary finding, which was then confirmed in more systematic studies. This was a study we ran at Mount Everest base camp, so the green line represents the sea level, the blue line is an intermediate altitude, and the red line is Everest base camp, 5,400 meters above sea level, acute exposure, so over a few days exposure. And when we calculated the nocturnal dipping, we found actually that it was considerably reduced and significantly reduced at base camp, not so much at the intermediate altitude. This one was done in healthy volunteers. We did a similar study in hypertensive patients. These were mild hypertensives, untreated at baseline, and then randomized to take either a combination therapy or placebo. And again, they were brought at high altitude for a couple of days. And again, on the left you can see the acute effect of high altitude, which was again an increase in blood pressure. But when you look at the dip in size of nocturnal blood pressure fall, you will see that high altitude in both groups tended to be reduced, but significantly so in the placebo group. What about when the permanence at high altitude, so high altitude exposure is prolonged? If you actually live there, and we know that there are about 100 million people who live at elevated altitude, so it might be relevant. This is a study we did in Peru, in Cerro de Pasco at 4,300 meters. This is a mining city of about 70,000 people, and we did studied a sample of about 300 people living permanently there. In this study, we did not have any comparison group, so we could not say whether their dipping was more or less compared to those who live at low altitude. But when we looked at what we found was actually that many of them had mask hypertension, so they had elevated ambulatory blood pressure but not office blood pressure. And when we looked specifically at mask hypertension subphenotypes, we found that half of them had actual isolated nocturnal hypertension. So there was no surprise that when we looked at the hypertensive people, they compared with normotensive ones, they had tended to have reduced dipping. And in terms of mechanisms, we can only speculate at the moment. We don't have direct evidence. One of the elements which was explaining the hypertension in these patients was excessive erythrocytosis. They produce much more red blood cells, so this could increase peripheral resistances. Hypervolemia, supine volume shift, and sympathetic activation could be involved, as well as central sleep apneas. But as I said, we can only speculate on this. And finally, I will anticipate these are data from the study we completed recently, so the analyses are in progress. We hope to publish them soon. This is a true population study, so it's a random sample from the cities in Peru, from Lima, which is the lowlands, and from 3 locations at high altitude between 3,200 and 4,300 meters. A sample of overall about 800 people, all with BPM data, and we found, I'm not talking about blood pressure results, just to summarize it, Highlanders had considerably lower average blood pressure values, but they had less dipping, so it's in line also with, from the data with we obtained with acute exposure to high altitude. So now it's probably time to try to understand better the reasons for this kind of pattern. As I said, for now we can only speculate. So to conclude, we can say that reduced circadian blood pressure variability, reduced dipping, is associated with, we know that it's associated with different pathological conditions and with adverse cardiovascular outcomes, and we know that there are several environmental factors which affect nocturnal blood pressure and dipping. Surely these include seasonal weather, seasonal changes, pollution and altitude, while the information about ambient noise is less consistent. There might be many mechanisms involved in this relationship, which need to be studied more extensively, and obviously at the moment we cannot say what the clinical implications of these findings could be. So on behalf also on the team I'm working with, thank you for your attention.
Thank you, Grzegorz, for your very interesting, inspiring talk, and we would like to